This is Dr. Greg Hall once again with Better Black Health, brought to you by Genetic Sequence Multivitamins, the only multivitamins made specifically to address the unique nutritional needs of African Americans. You can find them on Amazon. You can find them on sequencemultivitamins.com. They've been sold in all 50 states. Real happy to be able to have that as a resource. Back again today, Dr. Tim Goler, sociologist, educator, and public health scholar, whose work explores how structural racism, intergenerational stress, and life course changes shape our mental and emotional well-being of the Black community. So when we last talked, Tim, how you doing?
I'm doing well. I'm doing good. Thanks for asking.
Right. When we last met, boy, deepness. We went into the deep, right? We talked about how your grandmother who was born into slavery kissed your face, with that kind of term. That's how far away we are from all the ravages related to slavery. Not that far out. How I was born in a time when we didn't have a lot of rights, even though I wasn't aware of that. And so that is also an issue. And so what that oppression that we've experienced over the last 400 plus years has gotten us where we are today, really in a pickle, really, a pickle that requires a degree of urgency. So now I'm a physician. You're a sociologist. And so one of the things we talked about last time was how medicine is not really capturing, we're not doing our job as it relates particularly to Black patients in terms of recognizing where a lot of the diseases we see now, a lot of the stress and depression and anxiety and overdoses that we see in the Black community, we as physicians and clinicians are not addressing problem, you said, as it relates to being African American. That a lot of things we see, hypertension, obesity, these stress-driven things, are actually a result of this multi-generational oppression. Did I sum that up relatively well, Tim?
Yeah, I mean, well, let me just say, I wouldn't say that you weren't solving the problem. I mean, we operate in silos, and I think for what you do, I mean, you're the best at it, right? I mean, so I wouldn't say that we're not solving problems. I mean, you're not solving problems, but the disconnect between what's going, the and we'll get into it, the kind of the cultural memory, the generational traumas that weighs into what you're seeing in your office,
right?
So yeah.
Well, I didn't take it personally, so don't worry.
Yeah. I was like, please don't take it.
That where we are, because we're not, and we talked about how I wasn't trained to do what I think you need me to do. But before we get to that, so let's talk about, are we all traumatized? Is every African American traumatized in a way?
Absolutely. Yes.
So the question is whether we realize that we're traumatized.
Yeah,
right.
We are,
because we are absolutely traumatized. The question is,
But let me just go back just to give you, because you mentioned it earlier. Let me just kind of just hit on it. How closely tied we are to the trauma, right? Slavery ended in 1865. Mm-hmm. Right? It seems like this was a long time ago. Like, oh my God, that's so long. Why are you still talking about it? Well, that's when it legally ended, right? 1865. Well, I was born in 1965.
Right.
Right? I mean, so we had from the time slavery was over, from 1865 to 1965, that whole time period was under Jim Crow. That was all no rights, no nothing. We didn't get voting rights until I was born.
Right.
See what I'm saying?
Yeah, right.
So none of these systems, none of this stuff was designed for our health.
Mm-hmm.
Right? So yeah, the trauma is very, very close. And when you said earlier about my grandmother, right? It wasn't my grandmother that I kissed. It was her mother.
Oh, okay, you're
Her mother. That was her grandmother
right.
that I kissed. See
Your
what I'm saying?
grandmother's grandmother.
My grandmother's grandmother that I kissed, Grandma Rose,
Right,
who was born in the 18th, in the 19th, like she was born 20 years right after slavery ended in 1877, I think, around 1870. So I'm saying, imagine all the things that she felt. That was in my great grandmother, then that was in my grandmother, and that's in me.
right, right. And because that's that nature nurture thing. The nurture part is where that stuff is passed on, right? Right. So how do we, for the people who have no idea they're suffering from this, what's the first step for them?
Right. So I'll put it. How is this emotional trauma, right, or this cultural memory, if you will, because that's what we're talking about. This shared history. How does it shape the way Black people experience care, right?
Right.
Um, it shapes everything, absolutely everything. When we don't. Your patients don't just walk into your clinic, into your office, and sit in your waiting rooms as a blank slate.
Mm. Right, right. Their slate is actually full. Have you seen my
Right.
patients, right?
Yeah. I mean, what we're saying is that they're coming in there carrying generations of stories, generations of lessons and wounds within us.
Right.
Right. And for our people, like mistrust isn't just paranoia,
Mm.
it's memory.
Right.
Right?
Right.
That kind of hesitation you see, like when you're dealing with your pain, or when folks are when doctors are dealing with their pain, the kind of or the silence.
Right.
It isn't avoidance; it's protection.
Right. Right.
Right? It comes from kind of knowing, this kind of knowing, even before we can even name it. Right? We don't even know. Like our people don't even know that these systems that are in place weren't always built for us or with us in mind, right? And so it's just this cultural memory. What I'm talking about, this kind of we all have, as Black people, we all have a shared history, right? And that's what we're talking about. And in this shared history, it includes a whole lot of adaptation, having to adapt and figure out how to survive in spaces that weren't weren't you know weren't where our needs were centered, or where our pain isn't fully seen. I mean, we can talk about this all day about, and from your space, from the medical space, about how Black women go into the doctors, and they see, physicians and stuff see Black women's pain. So, some, by and large, there's research that says that they see Black women's pain differently. That they can, and that they can withstand way more pain than the normal.
Right. Which is not objectively not true, right? But yeah, they feel Black women particularly feel not listened to. There's data that shows that people that discount much of what they say. Like if you come in with chest pain, you're less apt to get an EKG and have them rule out a heart attack. Or
Right.
if you come in with cold symptoms, you're less apt to get treatment for that, right? And so
Exactly.
those things have been shown to be there. But how do we get off of the first step? I mean, like, what's the first step? I mean, we've got some people, just like anything, right? There's people that will use alcohol, for example. There's people that know they're an alcoholic. There's people that are alcoholics that have no idea that they're an alcoholic, right? And then
Mm-hmm.
people who aren't alcoholics, and people that don't drink. You're saying we're all traumatized, and it certainly makes sense that we would be, based on what's happened in these United States over the last 400 years.
What's going on today, right?
Yeah, you make you like wonder, if you're not traumatized, what happened, right? And so now we've got this situation. I have patients that know they were traumatized by their childhood, by their upbringing, by their neighborhood, and say, that's how I had a guy who needs a CPAP machine. And he said, my brothers used to torture me when I was little. They waterboarded me. They suffocate me. They cover my mouth. And now I can't have anything cover my mouth. So now in my mind, he's got to die from sleep apnea because his brothers traumatized him because his parents didn't supervise him. You know what I mean?
Right.
Properly, but they were doing all that because of everything they were exposed to. So it's not really his brother's fault. So he knows he's traumatized. But then I got people that come in who are traumatized and have no clue. And I'm not the person to tell them that they're traumatized. Who can tell them?
Well, it may not be you, the person who tells them, right?
Mm.
But okay, I think we're talking outside of this traditional medicine in a sense.
We are.
I mean, even this conversation we're having, right? This is not a conversation that is folks in medical school and folks in getting PhDs in sociology are not talking about what we're talking about
right.
Because the way the education system is set up is set up to be siloed.
Mm.
But this conversation is what we need to be having in terms of so yes, you might not say that, right? Or you might say, well, you traumatized. But it's the recognition that the whole person has to, it's like even when care is available, even when and sometimes we don't, when we can't or we don't fully engage it, right? We have to take in consideration if the care doesn't take in consideration or acknowledge kind of what you're just mentioned, and I call it the cultural memory or our shared history.
Right.
If it ignores that, and ignores what we're carrying, and not just as brothers, right? Because his brothers act the way they act because of how we've been acculturated, what they know. They don't know what they don't know what they don't know.
Right.
So when it looks like resistance from the outside might be, folks, trying to survive,
Right.
I'm saying that it's up to us. What I say, the burden is on the one who knows. So if you know this,
right.
Yeah. Right. I mean, if you know this, if we know this as people that love our people and want to see us healthy and thriving, regardless of what is, I mean, we don't have to act as if we're giving some kind of therapeutic. You're not a psychiatrist, right?
And what you're saying, I mean, but really is that I can actually talk about it in a sense to say that we are all traumatized. Just like if you're in an AA meeting, we're all alcoholics. So no one's pointing a finger, at anyone. And so the same thing could be true for now. If you're a white provider, then it's like you've been traumatized by these last 400 years, and I'm sorry for you, and I'm sorry for what my ancestors did to you. That's not really moving the needle as much as saying, look, whether you realize it or not, we've all been traumatized. I have this conversation with everyone, whether you realize it or not, you're vitamin D deficient. You don't know, but I'm about to draw this blood test, but I'm telling you now it's going to be low, and it causes all these diseases. And so people look at me like, I'll just eat better. Well, you can't eat your way out of this. And all this trauma we're seeing, we can't just live past it. We've got to kind of reconcile with it. Isn't that what you're saying?
Yeah, well, I'm saying what was the last book you wrote? Wasn't it about focusing on African Americans and their health?
Yeah, right.
You have vitamins that focus specifically on. It's because you understand the cultural context. You understand that that what moves us from just addressing symptoms, is also understanding that there is something special, if you will, about our experience as African Americans in this country. And by recognizing that, that's how you end up building trust and making real connections with people, right? And so you inherently understand this, but that's just you.
Need some help.
You need some help.
Right, which is really what this is about. To really talk about it and say, how do we, and having the person realize that they are in some way traumatized. Definitely more people more traumatized than others, right?
But it's not. But let me just say, well, I'm just going to say this idea of being traumatized, right? Trauma becomes such a, it's like, oh, everybody's suffering from trauma, right? I mean, it becomes more of a catchy phrase,
right?
But it's really clearing out the fog that we have in our minds as Black people. We have been so conditioned by the conditions of the space. Like you can look at what's going on today. I mean, they're trying to ban books and erase the erasure of us, right? And you think that doesn't have an impact on who we are as a people. And but once you have a sense of your identity, in terms of I'm not talking about sexual identity. I'm talking about once you have a sense of your identity, then you move differently. You pay more attention to your health. You pay more attention to your relationships. Not you just not just with yourself, but with your family, with your community, right? And so for many of us, the problem of our health is not that we don't care about our health, it's because our clarity has been challenged over time. And that has had a profound impact on how we move through the world and how we treat ourselves and others. See what I'm saying? So the trauma part, I don't want to get hung up on the word trauma.
Right.
Because it's not just an issue of trauma. It is an issue of how we actually think every day. That's how we think.
Right. And we're not thinking clearly.
No, we are not thinking clearly.
Give me an example of not thinking clearly.
Look at I happen to be a Black man, and you happen to be a Black man. A lot of our Black men are not thinking clearly, have not been thinking clearly. What I mean by that is we have not. If we were thinking more clearly, our families would be intact. Our relationships would be more whole. Our community would be strong if we were thinking clearly.
Right.
It's not that we have bad intentions. It's not that we are out in the world trying to do, not make good decisions.
Right.
But what's compounded on us, I mean, and it's just a fact. Since we've been in these United States, it's been a concerted effort to diminish Black men. And that have had a tremendous impact on who we are and our families and our community. And I think I shared this once before. I said that the sanity of our community is heavily dependent upon the sanity of Black men.
Right. Because we.
I mean, who has Dr. Hall? Who has the most? I mean, the most health disparities. I mean, usually it's Black men.
Yeah. No, absolutely. We've got the worst. Out of
the worst.
Yeah, no, it's no question about it. Worst cancer, worst all of that, and that's because we're kind of like second class citizen number one. I mean, we talked about the number one cause of death from age 1 to 42 for African American males. The number one cause of death, homicide from 1 to 40, right? That's crazy. So we're either someone's killing us or we're killing us, each other, right?
I mean, but imagine that, right? I mean, if it is us killing each other, right? Because remember the whole used to be this Black on Black crime, right? If it is us killing each other, it's not because uh, it's more of a symptom of I don't love myself, so I look at you and see you as a reflection of me, and so I don't love you either, and I'm not afraid of you, and so I'll kill you.
Right, right, right.
If we knew who we were, if we knew had a sense of our own identity, which is driven from love, I would be looking at you like, I love you, brother. I have, and then we can work whatever we need to work out. We work out. I'm not looking at you like I hate you, but it's our conditions. Environment a lot of times dictates behavior.
Right, right.
Right. So yeah. I mean, and so
Of not liking yourself.
the question of not liking yourself. So what I'm trying to say is that our health conditions, our physical health conditions, are intrinsically tied to how we think.
Mm-hmm.
But when we go to diagnose from a medical sense, you know, a lot of times we miss that part because that's not part of the medical diagnosis is the mental part.
Right.
And so it takes and vice versa, you know, from whoever's a psychiatrist and so, you know, a social worker, whatever. It's having the understanding of the complete person, the shared history of the people.
So when do you take the time to look at yourself and sort of say something? I mean, sometimes people have to be deliberate about saying good things about, the self-affirmation. I'm a good person. I'm a good husband. I'm a good father. You have to tell yourself that. You have to make a point of telling yourself, because that's not your gut reaction, right? I mean, that's not your gut reaction. I have to kind of go through this process of doing it, because I'm not good. I don't make as much as I should have done this. I should have done that, right? And so that aspect of how we look at ourselves, how do we get out of that?
That is the hard part, right? The hard part is, I mean, it's very difficult to question your own inherent beliefs, right? Because we're born into what we think we know, right? I mean, I was born, and now I'm a Pentecostal. I'm born into being a Catholic. I'm born into a certain ideology, right? So when we're born into it. I'm born and grew up in Glenville,
right?
You know what I mean? You know what I'm saying? Instead of Shaker Heights, right? And so it's that's the hard part, right? And so I think the one way is to continually talk the truth to people, because it is I think inherent in everybody is love. And I think that people know, I mean, once the truth hits people, they go, oh, that makes sense.
Right.
But it's very difficult to unlearn. And that's one part of the thing we have to be able to figure out. How do you unlearn the distortions?
Right, right.
Learn
how that's in our head.
How do you it takes a person, man, female, to be able to be humble to themselves. That is very difficult.
Right.
That's very difficult to be, and especially today with all these distractions we got in the world.
Right, right.
So it takes, I think it takes, what they say, it takes a village, but it takes people continuing to, like what we're trying to do right now, is share truths and share information about what we need to do to try to be in a better place, health-wise, mentally and physically. And it takes people to want to have the desire to be better.
Right. And I think that's the problem. There are people that's just not a priority. Their health is not a priority. And I had a guy who was, he was a maintenance man for a big building. And I said, so I know preventative, the benefits of prevention, right? You change the filters in the furnace when there's a leak. When it rains outside, what part of the building is potentially going to leak. You know where to put the bucket. so it doesn't destroy other things. So you know how to do prevention, but when it comes to our own health, it somehow is not important. And really, what I'm sort of now the light bulb coming from me is it's because they really don't care about themselves. They really don't like themselves, and that's why, like you say, with the black on black crime, and in a sense, or they're not a priority, or they can't see themselves as the beautiful person that they are, but it's deeper than I got other priorities, which is always what people say. I got the family, I got to make a house note, I got a car note. I don't have time to get a colonoscopy. I don't have a time, to take blood pressure medicine or to exercise 30 minutes a day.
Right.
And but the key is not time. The key is how they feel about themselves.
Yeah, that and you know, you know, here's the question: how do you heal when the damage feels like home?
Right. Wow. Yeah.
How do you heal
Mm.
when the damage feels like home? What I'm saying is, we only know what we know, what we know, what we know, right? And so a lot of people are just comfortable. We live in, and there's nothing you can tell me um, that my mind is not clear, that I am not, I'm vice president of such and such.
Right.
I'm the president of such and such. I'm the executive director of such and such. I'm the mayor. I'm the president.
Mm.
I have a good family. I drive a nice car. I have a PhD. All of these things um, look as if all is well.
Mm-hmm.
All is well. So how do you heal? You know, how do you heal
When you don't even know
when the damage feels like home? You're good.
you don't even know you need to heal.
You don't even know you need it. So that's part of the. And then a lot of times, so it's a process. I mean, it's a process. But you get people get comfortable. I'm making my money. I'm good. I got money. And then you can think about, how that plays out in terms of what we consider to be community,
Right.
right? I'm black when convenient. Otherwise, I don't got nothing to do with you
Right.
because I got mine.
Right.
So but you have to want to be, you have to want to be whole, if you will.
Right.
Right. So it's a challenge. It's definitely a challenge, but I think that it's where we are, right? I think that's where we are.
And so when we get to the point where we realize that we're not whole, then what's the next step?
I think the next step, when you begin to realize that you're not whole, is the desire to kind of want to. So we have to, somebody's. I asked somebody that same question I just posed, and somebody said, first thing they said was pray, right?
Right. Right. Well,
And that's usually the question that's usually what, in our community that people will say.
mhm. And that's
And I
just like mindfulness. It's just like yoga. I mean, it's just getting into get into your head. Um, um, that's what prayer is. You know what I'm saying?
yeah,
Right? It's just kind of
yeah,
you and God, but it's you in your head.
yeah, being still, being able to be still, being able to be like you said, be mindful, to be able to be thoughtful.
Right.
It took me a long time, just personally. It took me a long time. When I was younger, I thought, I'm just out here trying to figure it out, and I thought whatever moves I was making, I was moving based on what I thought I was doing right. But I never thought that how my actions affected other people. It took me a long time before I got to a place where I was said, well, I need, to be more thoughtful.
Right.
In order to be more thoughtful, you have to kind of pause.
Right.
you know,
Being yourself. Yeah.
and part of always being busy also is a trauma response.
Hmm. Right.
Constantly being busy, constantly, and you know this so too well about how people, everybody's busy. Yeah, I'm busy. 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 And then you look around and say, well, what's changed?
Right. Yeah. With all that busyness, what have you changed? What have you moved
What
on? Yeah.
What's changed? The community looks the same. Matter of fact, it's getting worse. Our families getting are not strong.
Right.
They're fragile,
Right.
and everybody's busy. What?
Crazy, crazy, crazy. Well, listen, Tim, you wrote an article called "To Unmake a People" in the Real Deal, and we're going to talk about next time we come together, because really, it's like we are where we are right now. Now, how do we get reborn, or how do we unmake us the way that we are? And so, again, Dr. Tim Goler, sociologist, educator. Out down at Norfolk State University. You just got a promotion. Tell us about that.
It ain't nothing. I got promoted from assistant professor to associate professor.
It's a
So
big deal. It's a big deal. They take they take their time promoting us in the academic world. Let's just say this about that. So I'm happy that they were able to do that, and
yeah,
we're happy to have you. And so we look forward to having you back next time.
yeah, I appreciate it. I'm looking forward to it too.
All right. You take care.
Take care.